Dr. Ferrer, we're live. You may begin.
Good evening, and thank you so much for joining us for tonight's virtual town hall on the post-fire air, soil, and water assessment plan. I'm Barbara Ferrer, Director of the Los Angeles County Department of Public Health, and I'll be serving as your host and moderator tonight. I want to start our town hall by reading the LA County Land Acknowledgement. The County of Los Angeles recognizes that we occupy land originally and still inhabited and cared for by the Tongva, Tatavian, Serrano, Quiche, and Chumash peoples. We honor and pay respect to their elders and descendants, past, present, and emerging, as they continue their stewardship of these lands and waters. We acknowledge that settler colonization resulted in land seizure, disease, subjugation, slavery, relocation, broken promises, genocide, and multi-generational trauma. This acknowledgement demonstrates our responsibility and commitment to truth, healing, and reconciliation, and to elevating the stories, culture, and community of the original inhabitants of Los Angeles County. We are grateful to have the opportunity to live and work on these ancestral lands. We are dedicated to growing and sustaining relationships with Native peoples and local tribal governments, including, in no particular order, the Fernandino Tatavian Band of Mission Indians, the Gabrielino Tongva Indians of the California Tribal Council, the Gabrieleno Tongva San Gabriel Band of Mission Indians, the Gabrieleno Band of Mission Indians, Quiche Nation, the San Manuel Band of Mission Indians, and the San Fernando Band of Mission Indians. To learn more about the First Peoples of Los Angeles County, please visit the Los Angeles City County Native American Indian Commission website at lanaic.lacounty.gov. Thank you. As we open tonight's discussion, I want to take a moment to reflect on the impact these fires have had on our communities. We extend our deepest sympathy to those who have experienced loss and hardship, and we remain committed to supporting every resident, worker, and business throughout the recovery process. We use these town halls to provide clear, timely, and transparent updates on assessments done by a wide variety of researchers to assess the impact of the fires, including the latest testing results and steps that can be taken to mitigate the negative impact of the fires. This includes reporting on air quality monitoring, soil and water testing, and the health guidance that follows. We appreciate that this information is critical for those who are rebuilding, making decisions about returning home, living in their homes, and trying to understand potential risks in the environment. Tonight's town hall is also designed to be a two-way conversation. We'll be spending a significant portion of the event answering your questions, both those you've submitted in advance and those that you post live in the comments sections on YouTube, Facebook, and X. This event is also accessible for Spanish speakers, with interpretation available right now by calling 1-800-805-1150. Para escuchar en español, por favor, llame al 1-800-805-1150. I want to thank our technical experts, agency partners, and the many community organizations that have helped us pull together assessment information. This work is a collective effort, and tonight's town hall reflects our shared commitment to ensuring that all residents have the information they need to help make informed decisions. To get us started, it's my pleasure to introduce Dr. Payam Pakbin, Atmospheric Measurements Manager at the South Coast Air Quality Management District. Dr. Pakbin will share the latest air quality test results and help us understand what those results mean for residents in fire-impacted communities. Welcome, Dr. Pakbin.
Thank you and good evening, everyone. Let me share my screen. Is the slide showing up okay?
Yes, we can see it, Dr. Bachman.
Okay, great. Good evening, everyone. So today I'm just going to give a quick summary of the air monitoring activities conducted by South Coast AQMD after the LA fires in Altadena and Palisades. Uh, So during the first stage and right after the fires were controlled, we did air monitoring in the burn area zones, both in Palisades and Eaton fire areas, using mobile monitoring platforms. These are basically mobile platforms are basically a vehicle where air monitoring equipment is on board of these vehicles, and we can drive in the communities in the blocks and take measurements of different pollutants. One of these mobile platforms measures particulate matter and what is contained in the particulate matter, like air toxic metals. And then the second mobile platform was measuring gaseous pollutant. These are volatile organic compounds. Basically, the main objective of these mobile monitoring surveys was to identify areas where some of the pollutants could be elevated. This could help us with assessing the impacts and also help identifying locations for setting up temporary stationary air monitoring for more long-term measurements. Basically, mobile monitoring gives a snapshot. It only takes measurements on the day of the survey and at the location where the mobile platform is. For a better assessment, we use stationary measurements. And that takes us to the second stage where stationary air monitoring sites were established in both Eaton and Palisades burn areas. There were multiple criteria for selection of the sites. One of them was the mobile monitoring results. We were focusing on areas where we were seeing some elevated levels of some of those air toxics. It also depended on the location of the cleanup activity, where the receptors, sensitive receptors and residential areas were located, the meteorology, and also availability of sites. So each site were equipped with multiple different air monitoring and sampling devices. Basically, we were collecting 24-hour samples and continue to collect 24-hour samples once every 3 days. The samples are taken back to a lab and we analyze for toxic metals, including lead and arsenic. And another sample is used for analysis for asbestos. All of the sites, we also measure the concentration levels of PM2.5 and PM10. These are particulate matter in the size of 2.5 micrometers and 10 micrometers. Larger particles are more associated with resuspension of dust, and PM2.5 or fine particles are much smaller particles, typically associated with smoke or vehicle exhaust and other sources like that. We've also created a data access and visualization dashboard, which is publicly available. I will share a link at the end of this presentation so that you can access all of this information. It provides the hourly PM2.5 and PM10 mass concentration. And then because the samples have to be collected and taken to a lab, usually data is available about a week after collection of those samples. All of the information is posted on this website. I'm going to give a very brief summary of results so far. So in Palisades fire area, we've seen that occasionally some of the air toxic metals, for example, arsenic, nickel, chromium, manganese, and selenium, were above background levels. Background levels are basically based on our air toxic measurements done across Los Angeles County. In this case, we compare the levels with the levels that we've measured over one full year in Los Angeles. So like when levels are above background level, In this case, they were slightly higher than the maximum that we've measured in central Los Angeles, but only slightly higher and significantly below the health threshold, so they don't pose any immediate health risk. Lead on all of the samples we've taken so far has been within background levels. And then another sample was used for asbestos analysis. So far, all of the asbestos have been non-detect. We haven't detected any asbestos in those samples, except on one sample in one of the sites on March 11th. And then on the second site, detection was, we detected asbestos on March 26th and on the sample collected on April 13th. All of the continuous PM10 and PM2.5 hourly data so far have been below federal standards. If you visit our data dashboard, for example, for PM2.5 and PM10, you will see a plot similar to this. It shows the 24-hour concentration levels, and you can compare it with federal and in the case of PM10 for state standard as well. You can also access all of the metals data. Here, there are many different elements and metals that we measure for. I've selected the most important ones that we've been focusing in our air monitoring activities: lead, arsenic, chromium, and nickel. Lead, as I mentioned, has been within background, which in this plot is shown as a hash gray area. For arsenic, chromium, and nickel, at the beginning of the measurements, during February, samples showed levels above background levels, but levels have been going down, and occasionally we see slightly higher exceedances of those background levels. And then a similar summary of results for Eaton fire area. All air toxic metals, including lead and arsenic, have been within background levels, with only a couple of exceptions so far in Eaton, in Altadena, basically. So occasionally, two air toxic metals, selenium and beryllium, were slightly above background levels, but no immediate health risk. And asbestos was detected at two sites on March 5th and at one site on April 7th, and all of the other samples were non-detect. Continuous PM10 and PM2.5 hourly data, like all the 24-hour averages based on the hourly data, are below federal standards. And this is similar example for metals for Eaton fire area. All of this information and a lot more is posted and available on our wildfire response webpage. You can scan this QR code or go to the link below. I can leave the link as well on the chat. It includes, information on the summary of the activities, what type of air monitoring has been done. It has the link to the data dashboard where you can access and visualize the air quality data, and it includes a lot more information. We also have an email. If you have any inquiries, any questions, you can reach out to us through that email. And this is my email if you want to contact me directly. Thank you so much, and back to you, Barbara.
Yeah, thank you so much, Dr. Papkin, for joining us tonight and for providing us with those updates. And I know we have some questions coming in for you that we'll get to after everyone has an opportunity to present. Now we're going to hear from Dr. Love with Rue Associates. Dr. Love, many of you know, he's been with us a few times before. He's leading the technical soil testing efforts that are sponsored by the county. He's going to walk us through the latest soil assessment results, including data from stage 3 testing, and he'll explain what these findings indicate about potential health risks and how much they can inform recovery planning. Welcome, Dr. Love.
Great. Thank you for having me back. Today, talking about some additional findings from some of the representative soil samples. As Dr. Ferrer indicated, prior to this, the presentations have been focused on parcels with intact structures. and most of our sampling actually involved those types of parcels. But tonight, we're going to talk about the sampling that we did on parcels where the structures were destroyed, and the Army Corps of Engineers came in and did some soil and debris removal. Next slide, please. Next. So our approach to evaluating the parcels with destroyed structures is we went to 15 parcels in each fire area, so 30 parcels total. And then we took 10 samples from each parcel. We gridded the parcel out, sort of as the figure on the right shows, with that sort of 10 squares in the parcel, and we would take one sample from each one of those areas to sort of spread the samples that we were taking across the entire parcel. Now, for folks that have seen some of these parcels, they know the entire parcel doesn't have the soil removed. The soil was removed only from areas where there was sort of an ash footprint around where the destroyed structure burned. And so we, in our analysis and sampling, were able to indicate and record which samples we took that were from areas where the U.S. Army Corps soil debris removal occurred, and areas where the original surface soil remained. And so we looked at what those soils looked like both separately and then together as an entire parcel. And in order to compare that data to something, we compared it to what the ash samples were like that we had taken in stage 1 of our sampling. So what is that? What are the characteristics of the parcel if you would have just left the ash behind? Next slide. So we're going to jump into the Eaton results. I know this is a big, busy table with lots of numbers. On the left-hand side are all the different chemicals that we measured. And then across the top are the different types of parcels that we sampled. The stage 3 sampling for destroyed parcels after Army Corps of Engineers are in the red box. The column on the left that it has at the top says soil and debris removed. That is soil samples that we took where U.S. Army Corps had removed soil. And the column on the right is the area where the soil had not been removed yet, where the surface soil that was originally on the parcel remained on the parcel. The thing to note about both columns is that there are still some, and these numbers on this column are the percent exceedances of residential screening levels, as I've shown in prior talks. And so one thing to note is that you can still see that there are some exceedances in both the area where the soil has been removed and in the area where the original soil remains. Although if you compare the number of exceedances where the soil was removed to the exceedances where there was originally ash, and that's the column all the way to the left where it says destroyed ash, you can see that the numbers decrease in the area where the soil was removed. So from an exceedance standpoint, there's been an improvement by having the soil removed, although it doesn't remove all of the exceedances. The thing to note is after that if you compare the soil removed to the area where the soil was not removed, in fact, you see higher percentages of exceedances in the area not removed compared to where the soil was removed. Now, I want to show another way of presenting this because I know all of this can be sort of a little difficult to understand. So let's go to
Dr. Love, just before you go on, can you just remind people that the destroyed and scraped and the destroyed and unscraped columns were samples that were taken from the same parcels?
Yes, right. So and that's what, in terms of the map that I showed on the previous slide, those are all from the same parcel. We just were designated whether or not the sample that was taken in the grid were samples that were from the area where the soil was removed versus area where the soil was not removed on those parcels, same parcel.
Yeah, same parcel. I mean, really, this is the reality for many of the properties. The Army Corps removed debris from what they called the burn scar on the property. There were other parts of the property that, in fact, did not have debris removal, and the sampling was on that parcel in both those locations. Am I correct in that?
Yes.
Okay.
So next slide. Another way to look at this comparison is by looking at the difference in the associated human health risk from the soils. In this case, we did a calculation of what's called a cumulative human health risk assessment. It's a complicated calculation that I'm not going to go through all the details tonight, but it essentially estimates the lifetime cancer risk from these soils under the different conditions. And so the column that's on the left there, and you measure it in terms of sort of excess cancer risk over the course of a lifetime, where 1 in 1 million is considered, the minimum, or not the minimum, an amount to which nobody worries about risk if it's below 1 in a million. And for things like dioxins, cleanup levels are set at more like 10 in 1 million. So if you look at these columns, you can see all of them are below the sort of cleanup levels for something like dioxins that's 10 in 1 million. But the thing to note is that if you compare the risk associated with the ash compared with the risk associated with the soil and debris removed, which is the second bar, you can see that the bar goes significantly down, and that the removal significantly decreases the amount of risk associated with the soil and debris removal. And again, just like looking at the tables where there were more exceedances in the soil that was not removed, you can see here that the residual risk from the soils that are not removed are just a little bit higher than what you see where the soil and debris was removed. So while the U.S. Army Corps doesn't decrease the risk in the Eaton area down to 0, it does reflect a significant improvement in the risk associated with the soils there. Next slide. So Palisades is a similar story, although the number of exceedance in Palisades is even less. Again, if you focus on the numbers in the red box, that's where the destroyed numbers are located for where the soil debris was removed versus where the soil and debris was not removed by the Army Corps. And again, the area where the soil and debris was removed shows a significant decrease in exceedances of residential screening levels compared to what the original ash was, which is in the column all the way to the left. And as with Eaton, if you look at the exceedance percentages in the area where the soil was not removed from the same parcel, you can see that that the percentage of exceedances in the soils that were not removed are actually higher than in the area that it was removed. Next slide. And so if we look at the same sort of health risk graph, in this case, the differences in risk are even more dramatic. The ash itself has health risks that are above the 10 in 1 million level as ash alone. But when the ash was removed, it dropped the risk associated with soil and debris even below the 1 in 1 million risk rate. And again, just like we saw with Eaton, the area that was not removed actually has a slightly higher risk associated with it compared to where the Army Corps came in and did the soil removal. Next slide. So looking at these stage 3 results from the Army Corps soil removal areas, it shows that during this process, areas of the destroyed properties, even after soil removal, can still have areas where the concentration in soils exceed residential screening levels, both in the areas where the soil was removed and in the areas where the soils were not removed. Given that, soil impact assessment and management really should be part of any rebuilding plan. You may want to consider getting an assessment by an environmental professional in order to ensure you're taking the appropriate steps to be protected of people that visit your home. Soil management doesn't necessarily require soil removal, as there are a lot of on-site mitigation and management steps that can prevent exposure. And that's the type of thing that you can work with an environmental professional to determine what fits your situation. It is recommended that any soil testing for soil impacts focus on soils that will be in high use areas, exposed areas like play areas, outdoor eating areas, gardens, and walkways in the final rebuilding configuration. And that the locations that are beneath where the final construction is going to be are not really important because those soils aren't going to be exposed to the future residents. Thank you.
Thanks so much. Thanks so much, Dr. Love. And again, I see some questions coming in, and we'll try to get to as many of those as possible. I really want to appreciate that you were able to do that. We try to keep these presentations really short. You had a lot of information to share, and I appreciate all the effort to keep it, within a few minutes so that we have more time for questions. Dr. Quick is the Chief Medical Advisor at the Los Angeles County Department of Public Health, and she's going to now talk about the implications of this latest testing data for public health for you all who are living in or near the burn areas. And she'll include some current mitigation recommendations, some of which you've heard from us before, but she'll also provide an overview of the lead testing programs that are being implemented. So good evening, Dr. Quick.
Good evening, and thank you everyone for joining us tonight. We do know that recovering from wildfire impacts isn't just about rebuilding homes. It's about rebuilding trust in the safety of our environment. This means the air that we breathe, the soil your children play in, and the water you use every day. We also know that the release of early soil testing raised real concerns, particularly in neighborhoods downwind of the Eaton fire. Tonight, I want to explain what we're doing in response, what we're seeing in the latest health data, and what you can do to protect yourself and your family. Can we go to the first slide, please? Perfect. So Dr. Love shared the recent results from the stage 3 soil sampling effort on destroyed parcels, and I want to highlight what we've learned so far. First, the results show that parcels with destroyed structures in both fire areas can still have areas where the concentration of chemicals in soil exceed residential screening levels after soil and debris removal. Knowing that, people should consider soil management as part of rebuilding, which may include an assessment by an environmental professional. Additionally, results from soil sampling efforts on intact parcels revealed a higher average lead concentrations in areas downwind and just outside of the Eaton fire area. Next slide, please. So let's talk about lead exposure impact. Given these findings, it's critical to understand the specific health risks posed by the chemicals detected, particularly lead, which remains one of our top concerns. Lead is a potent neurotoxin, and even at low-level exposure can affect learning, development, and behavior in young children. Lead exposure isn't always obvious. Symptoms don't show up right away or at all until the damage is already done. That's why we focused on prevention and early detection through both soil and blood testing. Next slide, please. Also important to protect yourself and your family from ash, soot, and other fire debris that may still be in and around your homes. Outdoors, make it a habit to wash patios, furniture, and driveways with water. Use a damp cloth to wipe off ash and soot from outdoor items like toys and tools. Indoors, wipe surfaces like counters and furniture with a damp cloth. Vacuum carpets and floors using a HEPA filter vacuum, and make sure to change filters in your HVAC system or air purifiers regularly. Finally, don't forget about the soil. Remove ash and debris from garden beds and lawns. Adding compost or mulch helps rebuild soil health, retain moisture, and reduce erosion. Keep monitoring your soil over time and continue adding organic material to support healthy growth. These steps help create a safer and cleaner environment, both inside and out, as communities continue to recover from the fire impacts. All right, next slide, please. As we think about reducing fire debris risk around our homes, we also must ensure workers doing the cleanup have proper protections. Since early April, the Office of Worker Health and Safety has been conducting weekly observations in both Altadena and the Palisades, along with other regulatory agencies, to monitor dust levels and look out for worker safety. So far, we've referred 10 sites to Cal OSHA for unsafe conditions and reached about 130 workers through PPE distribution and on-site training. Some of the issues we're seeing are serious. The most common concerns include workers dry cutting debris without water suppression, using heavy machinery near others with no barriers, and not having the right protective gear. Often these are seen on unpermitted or opt-out cleanup sites where oversight is limited. We have seen improvements where agencies are present, more compliance, more PPE, and safer work practices. We'll keep going out weekly, getting resources to workers and posting signs to make sure workers know their rights, protections, and where to report problems. Next slide, please. So let's talk about the blood results we've seen so far. Because once again, this is an important indicator of whether wildfire-related contamination is impacting residents' health. To date, nearly all results have come back below the CDC's reference value of 3.5 micrograms per deciliter, including amongst children and other high-risk groups. There have been 3 results above the CDC threshold, ranging from 3.9 to 5.7 micrograms per deciliter, all in men in their 70s. Public health nurses have followed up directly with each of them to provide tailored guidance and support. Now it's important to understand what the 3.5 threshold means. It is not a safety line, but it is a signal that someone's level is higher than what is seen in most children across the US. It helps us identify and respond to potential exposure early. No amount of lead is considered safe, especially for young children. That's why we're continuing to offer free testing and closely monitoring results over time as part of an ongoing strategy to detect any changes early and to take action where needed. Next slide, please. We do continue to offer free lead testing to all residents in impacted areas and urge residents to consider testing, especially if you have young children, are pregnant, or live near areas that were affected by fire debris. If you want to get your blood tested, here are the options available. You can request a free blood test by calling 1-800-LA-4-LEAD. Testing is offered through Quest Diagnostics and is completely confidential. We can help you find a Quest lab location that is most convenient for you and schedule the appointment. If you'd rather go to your own doctor, just ask for a blood lead test. It's part of standard care and especially important for children under the age of 6 and pregnant individuals. It is covered by Medi-Cal and most private insurances. We are also offering mobile blood lead testing at community events. We've been out in Santa Monica, Pasadena, and we'll be back in Malibu on May 17th and in Pasadena on May 24th. These are walk-up events open to all and will continue to expand location in the coming months. Please check the DPH Wildfire website as we are regularly adding new community events. Next slide, please. Now I want to provide details about what we're launching in the coming weeks to support residents in the Eaton Fire Downwind area. Following a motion by the Board of Supervisors on April 15th, Public Health has been directed to use up to $3 million from the county's lead paint hazard mitigation program to carry out large-scale residential soil testing. This is targeted specifically to homes downwind of the Eaton Fire, where we saw the most significant findings from the soil sampling conducted by Rue Associates and confirmed by multiple independent researchers. The program is expected to launch the week of May 19th and will run through December of this year. Here's what residents can expect. About 26,000 eligible homes will receive a postcard invitation to participate. The program uses a self-collection method model. Residents will be provided with simple, clear instructions on how to collect soil samples from their own yards. There will be no need to mail in your sample. Instead, we are setting up a local drop-off site in Altadena for convenience. Samples will be sent to certified laboratories contracted by the county. Residents should expect to receive results by email within 7 to 10 business days, along with a link to a dedicated web page that helps interpret results and offers health-based guidance on what to do next. The web page will launch alongside the program and will walk residents through understanding lab results, what levels of lead require action, how to reduce exposure and make your property safer, where to get free blood lead testing if you are concerned, and how to connect with remediation programs like Lead Free Homes LA, which offers lead paint hazard removal to eligible families. We are also planning door-to-door outreach in neighborhoods with highest lead results so that nobody misses the opportunity to participate. In addition, we're coordinating with community-based organizations, county departments, and trusted local partners to ensure that outreach is culturally appropriate, multilingual, and responsive to community needs. In closing, this is a long-term recovery effort, but we are making progress. Our investments in soil testing, education, and outreach are about giving residents the information and support they need to protect public health. Public health is here to help alongside county and community partners. Thank you very much for your time and engagement tonight.
Thanks so much, Dr. Quick. And our last speaker for the night is Dr. Campbell, who's the Chief Data Officer for the LA County Department of Public Health. Dr. Campbell is going to introduce our new public health dashboard, which makes environmental testing data accessible and understandable for all of you. So, Jake, Dr. Campbell, welcome.
Thank you, Dr. Pereira. And thanks everybody for joining. This will be quick, but just want to be able to share a little bit with you all. If you're here tonight, you're obviously interested in these results. We want to provide a simple way for you all to be able to find all this information and future information that is being made available in one spot. If you're not familiar, we will share the link with how to get to this page, but the County of Los Angeles has an open data portal. You can find that at data.lacounty.gov. From there, there's a list of departments where you can choose the Department of Public Health and be taken to our homepage. From this homepage, one of the top things that we highlight here under our initiatives is the post-fire assessment page. This is the dashboard where we have created an inventory of all of the different activity that is going on in this space and really streamlining access to all of this information in one place. There's a description here of some of the monitoring activities that are going on and what type of information you can find on this site. We've created and are maintaining a map that shows many of the post-fire assessment location activities that are going on both within our department and many of our partners that are involved in this. So you can get a look at both in either fire area, what type of activities are being done to monitor both the environment and health in that space in one spot for you to find that information. We have 4 different sub-pages dedicated to different information about air, surface and soil, water, and human health testing. And those are all linked here with a description of what type of information you'll find. You can click any of these Learn More buttons to be taken to each of these pages. If you also are routinely coming back to the site for more information, we've added a latest updates section here at the bottom. This shows really all of the major changes and additions that happen on this site by chronological date, so that if you have checked back recently, you can see pretty easily if we've already added any other new content of value for you, so that you don't have to go clicking around to try to determine if anything else is new has been added. If you click one of these Learn More pages, you'll be taken to an individual page. For this air monitoring page, you can see we have a number of sections that all follow the same template. There's an overview that talks about air or surface or water monitoring and what that is and means. We talk a bit about the relevance to human health and environmental health of this type of monitoring. As is existing already on another page, the DPH hosts, there's a number of different activities, many of which have either preliminary results or no results yet, or are forthcoming. And so this future edition section is really a table summary of a lot of the different activities that are underway at the moment, and will be added with a more detailed narrative and results section to these pages once they become available, but are currently still underway. Past these sections, you will see an assessment partner results area. In these, you can actually use this top navigation bar to get down here. And for every one of the partners that is presented at these different town halls and have results information available, we highlight what they are doing and the results of their work. And so you can see with South Coast AQMD, there's a summary here and a description as well. You can see when this information was last updated. We talk really at a high level about the results and what impacts we have found relative to environmental or human health. And then for the sites that have their own pages, you can click here and be taken directly to the information. And so you saw this earlier tonight, the South Coast AQMD site, where they have all of their own maps and additional data. If you are interested, those are linked. For other partners like Caltech, who also have their own sites, all of these direct data sources are made available here. For other partners that don't have their own sites available, we are hosting all their information available here. So you can see on these surface and soil testing pages, the information presented by Dr. Love earlier is available here, both in full detail. We have detailed findings of the results you can view a map of the different testing areas that they have been sampling from, and the results of that information is available. If you click down here in the results section, you can find all of the slides from before. There's also mobile-friendly versions of all of these applications and maps. So if you're on your phone, you can easily look at that information as well. Other sources of information, including testing sites, imaging from these different sites, what folks are doing where, and the results of those are all available for you here. So a wealth of information. Same is true with water monitoring. We have a network of folks that are doing a lot of good work in this space. We've got a map that shows all of the different samples that they are collecting and where they are doing that, links to their own content. And then, as you just saw, the blood lead level testing information is also available here with details, again, about how to get that testing and what the results have been. So all of this is available to you, and we will continue to update this on a regular basis as we have more information available. And feel free to check back routinely if you're interested. Thank you very much. And back to you, Dr. Ferrer.
Yeah, thanks a million, Dr. Campbell. And I really want to appreciate all the work. There's a lot of effort. There's a lot of folks who've been contributing to that effort, but I know that you've been sort of spearheading this drive to make sure that the information was somewhere where it was easy for people to be able to get to the information, easy to understand the information, and we could also keep it updated on a very regular basis. So want to appreciate you and your team for all the work on that. Now we're going to move into the question and answer period of our town hall for tonight. I'm pleased to welcome, I think Dr. Davis was going to try to join us. I don't see him on yet, but maybe he'll be on in a minute. And Janet Scully is with us as well. She's the program manager for the Office of Environmental Justice and Climate Health at the LA County Department of Public Health. Janet brings a lot of experience in our lead testing program, and she's going to help answer questions you had about the rollout of the soil testing. So let's start with questions about the soil testing. And again, I want to thank people, remind them you can continue to send us questions on the question bar on whatever social media platform you're on. But I do have over 100 questions already, so I'm going to get started and try to actually combine a few of the questions. This first question: I'm planning to rebuild. I want to know how I can get soil on my lot tested. So, Dr. Quick, I'll start with you, and Janet, please chime in as well.
The testing program that we have set up is due to launch May 19th. We will have information available on our website regarding eligibility. It's for those most effective, but if you had a property that is in the Eaton area that was destroyed and affected and want to participate in that program, just a quick recap, that's going to be a self-collected soil sample that you'll bring to our drop site in Altadena, and then the lab results will come directly back to you, paired with education related to how to interpret those results. So that expect that to roll out May 19th. There will be postcards that were sent out, but for folks that are ready to go right away, we will have information on drop sites.
Thank you so much. Janet, did you want to add anything?
Nope, that was great.
Okay, perfect. I'm going to just stay on soil testing for a little bit. There's a few questions. They're all really related to why isn't the city, or will the city or state pay for soil testing for all of the properties that were impacted by the fires? I want to add the corollary to that is that was the practice in the past, particularly for areas that were cleaned by the federal government. Why is that not happening? How can we make sure that all of the properties get tested?
So I'll start out with, what was that?
I'll let you start, Dr.
Okay. Okay. Couple comments on this. The big picture, I want to point out that Army Corps is the one who's doing the cleanup, but they have elected in this case to go down 6 inches and not do testing. You know, the results that Dr. Love just shared was the public health in the county's attempt to provide additional information for folks to kind of assess their situation, whether they be on an intact parcel or a destroyed parcel, and get an idea of what we're seeing there is the public health risk related to that. We are going to have the lead testing, the soil lead testing program for the Eaton area folks to be able to get further information on theirs. For individuals who are concerned to find themselves in a high risk, are in one of these areas, either Palisades or Eaton, where you have a destroyed property, going back to some of what Dr. Love recapped on the soil management during the rebuilding process is an important step also in reducing risk. So those are some of the big picture points to make on that.
And we do have a question from some folks in the Palisades wanting us to offer lead testing for them as well. You know, the compelling issue for us in the Eaton area was that we saw these unusually elevated concentrations downwind from the burn area. You know, downwind from the burn area in Palisades is the ocean. And so we didn't have a similar finding there. And that's what led to us offering this lead testing, the soil lead testing. If, you know, I do want to encourage folks to really check, particularly for those of you who have your properties that were totally destroyed. That kind of soil testing should be included as part of your rebuild package. Again, as Dr. Love indicated, you do need a soil management plan when you're rebuilding. There are, and we've listed them on our website, there are some relatively inexpensive places where you can, again, send your soil samples if you have those resources. I would encourage people who don't have any resources, are living in areas where there's been some evidence that there are concerns around lead, you know, go ahead and get in touch with us. You know, we again are going to try to help you figure out a way to really, you know, make sure you're getting the kind of information that you're going to need. But we have, you know, unfortunately scarce resources. You know, I want to point out in another community where we had a lot of lead contamination, there were parties that were responsible for that lead contamination, and it was much easier to find somebody to pay for all of the testing that really was required in areas where there was a lot of exposure. We don't have a similar situation here. We're working the best we can to really try to meet the needs of those of you who have the fewest resources to bear and to bring to this issue. So, you know, make sure, you know, get in touch with us. On our website, there is a place for you to send us a message. Somebody will get back to you. We'll do our very best to try to provide links to resources and help you sort of problem solve around getting soil tested. There's a couple of questions here we're not going to answer because they're really related to the Army Corps and the kind of certification that the Army Corps is offering once they do their cleaning. I'm going to urge folks, I know that there's a town hall on Monday with Supervisor Barger for folks who live in the Eaton fire area. And I think the Army Corps will be there as well. So, you know, I apologize. We'll send these questions over to the Army Corps, but we just don't have information, not able to answer that. I want to move back if it's okay, and I want to ask our Dr. Packman to get back on and help us. We have a fair amount of questions for you as well on air quality monitoring. We were previously told that the PM 2.5 measurement does not include asbestos and lead, but now they feel like they're being told that it does. Can you clarify?
Yes, so typically, lead, asbestos, and all of the other air toxic metals, if they are airborne and in the air, in the ambient air, they're in particulate matter. Now, PM2.5 refers to particulate matter with diameter smaller than 2.5 micrometers. This is typically the type of particles that comes from smoke or from vehicle exhaust. Today, we're talking about concerns related to resuspension of dust and ash. These are typically larger particles, and in order to measure for the air toxic metals and asbestos, we take samples for PM10. PM2.5 is still a subset of PM10. So like when we sample for PM10, it contains all the particles smaller than PM10. Typically, the resuspension of dust are larger particles.
Thank you so much. That was helpful for me, so I appreciate the clarity there. Thank you. I have some more questions for you if you don't mind staying on for a bit.
Of course.
Is VOC different than PM 2.5?
Absolutely. So VOC stands for volatile organic compounds, and these are basically the organic chemical compounds that in the ambient temperatures are usually evaporized. So like they're gaseous pollutants. They typically come from whatever biomass burning exhaust of vehicles can release volatile organic compounds. Now, when we're talking about PM2.5, that's particulate matter. They come in different sizes. Typically, resuspension of dust and ash are much larger particles, and then smaller particles like PM2.5, typically referred to as fine particles, come from sources like the smoke or from industrial emissions or exhaust of vehicles, or some of them can chemically form in the atmosphere. So like very briefly, VOCs are typically gaseous air pollutants. It could contain some air toxic contaminants, and PM 2.5 refers to particulate matter. So like these are aerosols and particles suspended in the air.
Thank you so much. There's a few questions about folks really hoping that they can get real-time air monitoring and alerts. So, there's questions about the ascent data being delayed. So could you just talk about what's available in real time? I mean, I know you talked a little bit about that in your presentation.
Yeah,
There
so
are a lot of questions here about how can we get this air quality data?
absolutely. So
Okay.
all the air measurements that South Coast AQMD does in the burn areas are available through that dashboard that I presented. And I can share the link, so hopefully that can be shared on social media. But it basically, that's all the air measurements within the burn area. Beyond that,
Is
South
that in real time? I mean, I think the question is that delayed? In other words, somebody is trying to figure out, is the air quality near my house okay today or okay
Mhm.
this hour? I want to go outside and I'm in the burn area and I want to know. And I'm going to just make this real. There's been a lot of trucks moving out debris. I want to know if that's having an impact on the air quality today. I know you have a monitor nearby. Is that information going to be up to date so that I could look at it and try to
Yes.
make a decision about what activity I'm going to do or not?
Thanks for clarification. Yes, our air monitors are two types. One of them is in real time, so like it updates on hourly basis. It tells you the concentration levels of PM. And for example, if there's lots of resuspension of dust, you would assume that PM10 could be elevated. There could be other reasons that PM10 could be elevated region-wide. For example, strong winds can resuspend dust in all the areas, even areas far away from the burn areas. So like that's another consideration, but is specifically to look at the content of PM and look at air toxic metals and asbestos. The technology that we have to use is by collecting the sample, and then once sampling is done, chemical analysis have to be done in a lab, and then report back. That information is only available 1 week after. But in order to make decisions about the day, yes, all the members of the public, the residents in the area can go to our website and look at the real-time PM2.5 and PM10 concentration levels. I think you also mentioned about Ascent Network. I want to mention that's independent from South Coast AQMD. They have a monitor in city of Pico Rivera. It's quite far away from Altadena. However, they measure hourly levels of air toxic metals. That is not available publicly, but I do want to mention that South Coast AQMD operates the same exact monitor. One of them is located in Huntington Park. One of them is located in city of Compton. All of that real-time information is available on our website in real time. These are also hourly measurements. So like that's another resource. And if you download the South Coast AQMD app, you have access not only to the real-time air quality data and maps, but also can receive air advisories so that we can forecast the information and beforehand send out information that, for example, tomorrow is a high wind event, there could be dust advisory in effect in your area. So if you are interested in air quality data, I highly recommend to download the South Coast AQMD app, and all this information is accessible through that app.
That's really helpful. I think if you don't mind, I'm going to ask one more question.
Please.
And then, we've got a lot of other questions, so I'll have to bring back some other folks as well. But I think this is a great question. Folks are asking, how do you know that the mobile monitoring unit data is accurate?
Mhm.
And I mean, I think it would be helpful to hear from you how you make sure that this data is accurate.
Absolutely. I have to mention that we use the state-of-the-art, most advanced air monitors that are installed in these vehicles for taking measurements. However, this technology and any technology is only good for the purposes and objectives of air monitoring. In this case, we use our mobile platform to do a survey. We wanted to cover the entire burn areas, both in Altadena and in Pacific Palisades. And in order to take measurements in block by block in the entire community, because you cannot have air monitors at every single corner, we relied on mobile monitoring. It allows us to drive around, take measurements. However, that's only giving you a snapshot. The data is accurate. However, it's only giving you a snapshot in time and location. Now we use that survey to determine the areas with elevated levels of, for example, air toxic metals. Our mobile monitoring also showed the VOCs, those gaseous air toxics, were all at the background levels after the fires. So like most of the air quality issue right now could be related to resuspension of dust, and that's particulate matter. Now, if we want to accurately look at the levels, the concentration levels, we rely on different technologies using a stationary monitoring. That means we establish a monitoring site and we do more long-term measurements. So like very briefly, the air quality is accurate. However, it's accurate for its purpose. The mobile monitoring's purpose is to survey areas and help us locate the best location for monitoring stations. And then we use a state-of-the-art technology to provide air monitoring data and air quality data that can be used for assessing the health impacts and make decisions.
That was great and much appreciated. Dr. Love, I'm just gonna bring you back also for some questions around the soil testing. I think there are a couple of questions that folks are asking about why there's a difference between what you found around lead contamination in the Palisades and lead contamination in Altadena. Wondering if that was related to the scraping that was done, or if there was some other factor contributing to that.
Yeah, I mean, The honest answer is we don't know what all the things that could be contributing to that, right? It could be related to the difference in the housing stock and the fact that the houses in the Eaton area are more likely to have lead-based paint, and that lead-based paint would be more likely to be in soils, especially around the structure. And so what we may be seeing is just sort of residual lead-based paint from historic painting of the buildings on that property. It could be from soils during the scrape that, got dislodged and are in the scraped area now, or ash that blew from adjacent parcels into the scraped area. There's a lot of different things that could explain why you still see some lead exceedances in some of the Eaton parcels. But we can't, just from the data that we collected, answer that question more specifically.
Oh, that's great. I think there's another set of questions that really are asking whether or not there should be for the remediation, if you do find contamination in the soil, what does that remediation need to look like? We've got some questions about, do you need to worry about the area where you're going to rebuild? Like the footprint for your house, I think is what they're referring to. There's other questions about what to do with yard areas. Based on your findings, I think there are a fair number of people who are saying, I'm going to assume my soil is contaminated. I'm probably going to try to get it tested, but I'm curious about what the suggestions are around mitigating, assuming that there might be some contamination.
Yeah, I mean, there's lots of different approaches to dealing with impacted soil. A lot of those don't require soil removal. And Dr. Quick talked about a lot of those in her presentation in terms of adding mulch and compost to soils. You can do things in terms of doing hardscaping or decking over parts that are potentially impacted. And so there are a lot of things you can do that sort of reduce the chance that you're going to have direct exposure to those impacted soils. But that's really why it's important to, if you're concerned about those exposures, to bring in an environmental professional to help you with those decisions, because everybody's parcel and how and to what degree they're impacted and where they're impacted compared to where you want to be able to use the property, all of those are going to be property-specific decisions to make.
Yeah, I think that's really helpful. I think the last question I would ask you is sort of a more general comment on how worried should people be about the long-term effects from exposures to fire debris. So I think people we're noting your sort of risk assessment. I think they're trying to figure out how that translates to an individual who's living in an area where there's still a fair amount of fire debris on people's property. There's winds that blow all the time here. And they're trying to, based on the findings you presented today, they're trying to figure out, what should they be worried about in terms of long-term exposures?
Sure. I think the guidance has consistently been
or long-term impacts from these exposures.
I think the guidance has consistently been to avoid, the actual debris itself unless you have appropriate protective equipment on. The degree to which there is some dust and stuff blowing from one property to the next, that can spread contamination, right? We know that. But remember that the risk levels that I showed represent lifetime exposures, right? 70-year lifetime exposures. And so, not that you want to experience any exposure to contamination at all, right? But, small incremental amounts are probably not even visible on those risk graphs that I showed, because those risk graphs represent, again, lifetime 70-year exposure durations, not exposure occasionally for a few weeks or a few months.
Thanks so much. Dr. Quick, I'm gonna see if you can jump back on. Based on, sort of what Dr. Love has been talking about, that there are some exposures. We've got a lot of questions on here about why isn't LA County issuing a health officer order? I mean, there are folks who would like us to issue an order that says that all the homes are uninhabitable, and since many people want to live in their homes, that would be extraordinarily hard to do. But there are other questions that just say, could there be some emergency order that would help us get resources for cleanup? Could we get emergency orders and public health orders that would make sure that there was more testing? So I want to be very for either emergency orders or health officer orders here.
So a couple thoughts on that. As far as the status, these areas did get local emergency as well as state emergency orders. And with that comes various actions that can be taken into consideration, helps with debris removal as well. As far as local action, I want to draw people's attention to a couple of things. There were health officer orders related to debris cleanup, which are really meant to ensure that this is done in a safe manner while, also we want to efficiently get the debris cleaned up because there's less exposure to everybody once that debris is appropriately cleaned and out of the communities. So there are health officer orders related to that. And we do have a public health advisory that's related to being within 250 yards of fire debris, pointing out that if you are residing within 250 yards, you may be more likely to be exposed and may be more likely to have symptoms. And so that's an acknowledgement locally of the potential risk of being near the debris. And then the order locally for debris cleanup also meant to protect community. As far as the orders that are in place for states of emergency, those were put into place by different governing bodies to help facilitate some of the debris removal and other emergency actions that come into play regarding cleanup, insurance, response, and so forth. I do understand the frustration of some folks in negotiating the process related to individual insurance companies and their individual ability to get the benefits that they need. We do have information on our website that can help with that, and that may be one where some specific guidance may be necessary, and calling, of course, for insurance commissioner and so forth. But I did want to highlight what we have done locally here.
Thanks so much, Dr. Quick. A couple other questions. One is, what is happening at our local schools with soil testing? And
Great.
so, I think this is going to be Pasadena, Altadena, and the Palisades area.
Yeah, great question. Schools have done a lot depending on where they are, including, I would point people to some of the local actions that have come out of Pasadena Public Health and Pasadena Unified School District and their recent sampling efforts that were done. And I would point out that schools across the affected areas have early on in some places done sampling and have gotten in environmental experts to help kind of guide the remediation if needed or cleaning process there. As a local health jurisdiction, and I know Pasadena Public Health as well has participated, as well as the state has given a lot of guidance to schools and been working really proactively with schools to provide the guidance needed related to reopening up of schools in a safe manner and acknowledging that we do want kids back in those learning environments when it's safe for them to be there. For individual questions about what an individual school has done, it's best to check with principal at that school so that you can find out what testing has been done there. But schools have been responsive to this and have prioritized testing and making sure that areas are safe for children. Another component of this that has been touched upon both by AQMD as well as Dr. Love, there is the potential while we still have fire debris in the community for some redistribution of that on windy days, weather events, and so forth. And I know schools are being proactive at continuing to monitor for conditions and so forth. And they do have plans for some of the schools that haven't yet opened for the following school year in place as well.
Yeah, thank you so much. That was really helpful. I'm going to ask you to just answer a couple more questions, Dr. Quick. And again, I want to note, like, we cannot speak for the Army Corps. We know that there are questions about what's happening at the golf course, but I will ask Dr. Quick to just let us know what kind of monitoring is the Army Corps doing at the golf course and at other sites where they are in fact doing some of the debris removal packaging.
Yeah, great question. And the monitoring that's taking place at the golf course being done by Army Corps, we can speak to it just sort of high level, is monitoring related to the workplace and what workers are exposed to. So they are monitoring, they do have monitoring set up to check levels that workers are exposed to with parameters in there for halting work and addressing things if that is exceeded. And you did hear from Dr. Packman earlier today in depth about the monitoring that South Coast Air Quality Management District is doing as well, including in the areas that may be affected if there were to be some particulate matter or so forth that comes out of the operations there. So those are two of the air quality ones, but specific to Army Corps, that is related to what their employees are in the workplace there.
Oh yeah, thank you for clarifying. And again, tomorrow night there's a town hall for folks that were impacted by the Eaton fire, and I believe the Army Corps will be at that town hall as well. So, we apologize for not being able to answer those questions specifically tonight. We're really concentrating on the assessment data that we have at these at this town hall. We do have a question about the pools in general. A lot of people are saying their pools, obviously, on their property are not, are contaminated. They're mosquito hazards. What's the plan?
So yeah, this is definitely a focus from both local as well as state Department of Public Health right now to figure out the best way to manage the potential for mosquito breeding in these pools while folks aren't in there. There are plans and a collaborative group working with the Vector Control District to figure out the best way to do this. There are some challenges related to the best way to accomplish this. Sometimes mosquito fish are the best to use in pools that are currently not being maintained, but there's residual chlorination in pools as well as contamination from the fire that's making that not the best, or maybe not an option for the immediate, but there are active plans right now in place and work on this. So stay tuned for more on what individuals can do and what the plan is for the larger vector control. Was there another question related to?
Well, I think the vector control folks are working closely with us, and there is a number you can call for vector control and talk with them about your particular situation. They are trying to get out to pools to prevent them from becoming breeding grounds for mosquitoes. So maybe, Brett, if there's any way you could post that on the social media channels, the number that they can use to call South Coast. I think they're South Coast Vector Control, mosquito vector control. What are they called?
San Gabriel is the
San
one
Gabriel,
for
right,
them.
for San Gabriel. So, so appreciate that. Yeah, I'm gonna go back to Dr. Packman, if I can, if you don't mind, a couple of other questions about toxic air that maybe you can answer. I think folks are concerned that what are the long-term impacts as well of toxic air? We spoke a little bit with Dr. Love about soil. We also have some questions about the impact of the long-term impact of toxic air, even if you're exposed to it for brief periods of time.
Yeah, that's not really my area of expertise, so I was wondering if maybe the
We go back to Dr. Quick.
Public Health could help
Yes,
with that.
okay. That's fair. I don't want to put you on the spot, but I'm happy to sort of ask Dr.
No,
Quick.
we work very closely with LADPH, so we can answer this type of questions.
Yeah, that's great. So Dr. Love or Dr. Quick, either, jump in.
Either one.
Yeah, I mean, so far, right, the monitoring hasn't shown exceedances except for, sort of occasional blips. Those occasional blips don't represent any either short-term or long-term health hazard. They're good to monitor, right? So that to be able to tell the difference between a blip and something that's a more consistent exposure. But so far, of the air quality data that I've reviewed, I haven't seen anything that is concerning from an air exposure standpoint.
Thank you. We also have some questions about the failure of trucks that are removing debris to cover their loads. Dr. Quick, I know that our team is actually, we have a place you can report that, and we will investigate. So is there a way for you to provide some more information about that?
Yeah, let me talk a little bit about the enforcement teams that are going out, which I touched on a bit when I talked about the worker safety, but we have teams from our Office of Worker Safety that are going out into both burn areas every week, and part of a larger group of the regulatory agencies. That those groups, if they see any violations, depending on what it is, if it's worker, it's going to go to Cal OSHA. If it's something related to trucks, it may go to Army Corps, it may go to Public Works, depending on what it is. So those are active sort of compliance teams that are out in the areas right now making referrals. For the specific question about trucks and not appropriate sort of wrapping of debris and so forth, we did hear that early on, as the debris cleanup began, that there was more of that, and now there is better compliance, and that's exactly what we want. We want to be out there and be improving the overall compliance, but we do have teams that are looking to that, and maybe if we can get that phone number also posted, we can do that as well.
That would be great. So Brett, if you don't mind trying to post that phone number for folks, I think that would be really helpful. Janet, thank you so much for being with us. I have a couple of questions for you as well. One is just a general question. What are the signs that parents should be looking for if they're worried that their child has had an exposure to lead? And actually, that can go to you. I know you have a lot of knowledge. Dr. Quick can also chime in.
I'll start and Dr. Quick can pick up anything I missed. I mean, I think that's the thing with lead is you don't always see symptoms right away. And so the only way to really know is by getting a blood lead test. But we can, with kids, see some developmental delays, some behavioral issues, some trouble learning. And I'll let Dr. Quick chime in with anything I missed.
I think that's exactly right. And just for a little bit of context, blood lead screening is part of sort of routine childhood screenings. And the reason why is because we know that it has negative consequences, and it's something that you're not going to necessarily pick up without doing that. So would really encourage folks who are in the area or concerned about that to go ahead and take advantage of our blood lead testing program, or go to your own doctor and kind of request it. It's the best way really to know whether or not there's a problem.
And if I could just add, what we're seeing with our blood lead testing, we're seeing a lot of adults getting tested, which is great, but we really do want to see more young kids get tested. So I really want to encourage parents to bring their kids out to the community events or take their kids to a Quest lab to get tested directly there.
Yeah, thank you. And another question, Janet, for you is, how often, okay, so I'm taking this from like 3 different people, but I think the question is, given that there's ongoing exposure or worry about ongoing exposure to lead, how often should I have my child tested, have their blood levels tested?
I mean, the recommendation is for them to be tested at 12 months and 24 months. This is a little different because we've got, fire and debris and all of those, the contaminants and potential exposures. So I don't know that there's a particular recommendation in this case. I think, so far we haven't seen any elevated levels in kids, which is great news. I think, the best thing parents could do is really prevent exposure. by not letting kids, dig around in the soil. They have this hand to mouth behavior. They want to put everything in their mouths. So make sure, parents are washing hands and washing toys and keeping kids out of the soil.
Yeah, Dr. Quick, anything to add?
I just want to do a second vote for what parents can do at home and ensuring that they've washed off, outdoor toys and not tracking dust in the home, making sure that, kids washing hands frequently goes a long way in this one.
Yeah, and I also want to urge any family members, if you've got concerns and questions, please see your medical provider and talk with your medical providers as well. Sadly in our country and even in our county, there's a lot of exposures to lead, and all of the providers that you are bringing your children to should have a lot of knowledge that they can share with you about, again, reducing exposures, but also around what makes sense for testing frequency for your child. So I'm going to urge you to stay in contact. And again, we can help you if you need help finding a provider. Please let us know about that as well. We're coming to the end of our time together. I do want to give each of our panelists just a couple of minutes to sort of summarize, close us out. So, I'm going to start with Dr. Pakbin. Any last messages that you want to send out to our community residents as we wind up this town hall?
Yeah, thank you. I just wanted to encourage everyone to check our website, specifically made for our air monitoring response to this wildfire in Eaton and Palisades. All of the information I presented and a lot more is available through that specific website. And then in general, if you want to know about air quality and you want to receive advisories in advance when there are dust advisories, I encourage everyone to download the South Coast AQMD app. It's very intuitive. You can access all of this information in the entire LA County, as well as Riverside, Orange County, and San Bernardino counties.
Thank you so much for joining us tonight. And I want to thank you and your team also. You've been amazing partners, and I know you've been responsive with the mobile monitoring trucks as well to concerns that residents were raising at the very beginning. So please pass along our gratitude.
My pleasure, and thanks for having me here.
So yeah, I'm gonna go to Dr. Love. Again, it would be great. I mean, you've been with us now for 3 stages of testing. I don't know if you're up for kind of summarizing what we've learned, and then how does that help people during the recovery process?
Yeah, I mean, I think we've been successful, right, in terms of increasing the awareness and our knowledge about what to expect in our neighborhoods, right? While we can't gather the information for everybody for their particular parcel, I think we're in a better place for knowing where and what we should be looking for, and sort of what levels sort of we should expect to find. I think the awareness of soil impacts are broader than just for these fires, even though the fires have brought this to a head, and the fact that these best management practices are useful all over the LA Basin because we have all sorts of sources that can impact our soils. And so these are not just lessons, these are not just mitigation techniques that folks should be thinking about as a result of the fire, but they should be thinking about them because we have all sorts of sources of contaminants that can impact our soils all over Los Angeles.
Thank you so much for that. And we'll close out with Dr. Quick.
So just wanted to, I know there's a lot of information out there, and just wanted to reiterate, we have a lot of guidance documents on our website related to individual circumstances people might find themselves in. If you're in an intact home, if you're looking for ways to clean up, things you should be considering for in-home, and would just urge people to to take a look at that. Also, the data dashboard that we had outlined earlier today is a great place for information. You've got all the information for the air, water, and soil where people can be informed. And just want to reiterate that those resources are out there. And it's also an opportunity for us to get out new information as things sort of unfold.
Thank you so much. I want to especially thank everybody who joined us tonight. I want to thank the communications team and the technical team for pulling us together. And I want to again extend our really heartfelt support for everyone during this recovery process. We know it's been a really long and in many ways devastating 4 months for so many of you. We're here to help. We'll continue to provide regular access through these town halls to the folks that are actually doing assessments in hopes we can answer your questions and provide you with information that's useful as we're on this recovery path. But again, thank you so much for being with us, and thanks to all our panelists. We'll see you